Welcome back to our channel. Do you know your heart is one of the most crucial organs in your body? It's responsible for pumping blood, which carries oxygen and nutrients to all parts of your body. It's important not to ignore this symptom, as it could be a sign of something serious going on. There are several types of chest pain, and not all of them indicate a heart attack. Leg and ankle swelling is a common symptom that many people tend to overlook or dismiss as a result of a long day on their feet. A sudden tearing or stabbing pain in the left side of the chest can be alarming. A persistent cough can be annoying and may seem like just another symptom of a common cold or flu. Early detection and treatment of heart conditions can significantly improve outcomes and prevent further complications. Remember, knowledge is power, and taking care of your heart is crucial for overall health and well-being. If you found this video helpful, please like and share for more informative content about heart health and other medical topics. Stay healthy and take care of your heart. However, it's important to pay attention to this symptom, as it may be a sign of something more serious, such as congestive heart failure or chronic obstructive pulmonary disease, COPD. These conditions can cause fluid to accumulate in the lungs, triggering a chronic cough. Additionally, coughing can also be a sign of high blood pressure, known as hypertension. When the arteries are narrowed due to high blood pressure, it can cause the heart to work harder, leading to fluid retention and a chronic cough. Other potential causes of a chronic cough include acid reflux, in which stomach acid flows back into the esophagus, causing irritation and a chronic cough. Several factors can increase the risk of developing a chronic cough, including smoking, exposure to secondhand smoke and air pollution, and a family history of lung or heart disease. If you have a chronic cough that persists for weeks or months, it's important to consult a doctor to determine the underlying cause and receive appropriate treatment. Treatment options will vary depending on the underlying cause of the cough. For example, if it's due to congestive heart failure, the doctor may prescribe medications to help the heart pump more efficiently. If the cough is caused by acid reflux, lifestyle changes such as avoiding trigger foods and eating smaller meals may be recommended. Quitting smoking and avoiding secondhand smoke and air pollution can also help prevent chronic cough. By seeking medical attention and following treatment recommendations, you can manage your cough and improve your overall quality of life. But it's important to take it seriously, as it may be a sign of a serious heart condition known as aortic aneurysm. An aortic aneurysm occurs when the aorta, the main artery that carries blood from the heart to the rest of the body, becomes abnormally enlarged, forming a bulge that can rupture. If the bulge tears, it can cause a life-threatening internal bleed. While aortic aneurysms can occur anywhere in the aorta, they most commonly affect the abdominal aorta. However, if an aneurysm occurs in the thoracic aorta, which passes through the chest, it can cause a tearing or stabbing pain on the left side of the chest. Other symptoms of aortic aneurysm include a pulsating sensation in the chest and a feeling of pressure or fullness in the upper abdomen. If you experience a sudden tearing or stabbing pain in the left side of your chest, seek medical attention immediately. Early diagnosis and treatment of aortic aneurysm can prevent rupture and reduce the risk of complications. The doctor will perform a physical exam and order tests such as an MRI or CT scan to visualize the aorta and look for any signs of an aneurysm. Treatment options will depend on the size and location of the aneurysm. In some cases, the doctor may recommend surgery to repair the aneurysm and prevent rupture. However, persistent swelling in the lower extremities can be an indicator of a more serious underlying issue, such as heart failure. When the heart isn't pumping efficiently, blood and fluid can back up in the legs and ankles, causing them to swell. Additionally, liver disease, kidney disease, and venous insufficiency can also contribute to leg and ankle swelling. If you notice that your legs and ankles are swollen, it's important to consult a doctor for proper diagnosis and treatment. The doctor will examine your legs and ask about your medical history, including any medications you're taking. They may also perform tests, such as an ultrasound or venogram, to evaluate the blood flow in your veins. Treatment options will depend on the underlying cause of the swelling. For example, if it's due to heart failure, the doctor may prescribe medications to help the heart pump more efficiently. Lifestyle changes, such as reducing salt intake and increasing physical activity, can also be helpful. Ignoring leg and ankle swelling can lead to more serious complications, such as skin ulcers or blood clots. Therefore, it's essential to seek medical attention if you experience persistent swelling in your lower extremities.
However,
It's always best to err on the side of caution and seek medical attention if you experience any type of chest discomfort. Some people describe the pain as a pressure or squeezing sensation in the chest, while others may feel a sharp, stabbing pain. The pain may radiate to the left arm, jaw, or back. Other signs that may occur along with chest pain include shortness of breath, cold sweats, and lightheadedness. If you suspect you're having a heart attack, don't hesitate to call emergency services. Early treatment can help reduce damage to the heart muscle and improve outcomes. But chest pain doesn't always mean heart attack. There are other conditions that can cause chest pain, such as acid reflux, stress, and anxiety. However, it's important to see a doctor to rule out any serious underlying causes. Even if it turns out to be something less serious, at least you'll have peace of mind knowing that you were checked out and there's no need to worry. If anything goes wrong with your heart, it can be life-threatening. It's crucial to pay attention to this symptom, especially if it occurs during physical activity or at rest. If you find yourself struggling to catch your breath or feeling like you're suffocating, it's time to seek medical attention. This symptom may indicate underlying health conditions such as asthma, allergies, or chronic obstructive pulmonary disease, COPD. However, it can also be a sign of something more serious, such as congestive heart failure. Congestive heart failure occurs when the heart isn't pumping blood effectively, leading to fluid buildup in the lungs and shortness of breath. If you experience persistent shortness of breath, it's essential to consult a doctor for proper diagnosis and treatment. They will perform a physical exam, review your medical history, and conduct tests such as an electrocardiogram, ECG, or chest X-ray to determine the underlying cause. Depending on the cause, treatment options may vary. For instance, if it's due to congestive heart failure, the doctor may prescribe medications to help the heart pump more efficiently or diuretics to remove excess fluid from the body. It's important not to ignore shortness of breath, as it can be a sign of a serious condition that requires medical attention. That's why it's essential to pay attention to any changes or abnormalities in your heart's function. Ignoring these signs can have serious consequences. So what are some alarming signs you shouldn't ignore about your heart? In today's video, we will discuss 5 alarming signs you shouldn't ignore about your heart. Stay tuned till the end. No. 1. Chest pain. Chest pain is one of the most common symptoms of a heart attack. Number 2. Shortness of breath. Shortness of breath can be a sign of various respiratory or cardiac issues. No. 3. Swollen legs and ankles. 4. Tearing or stabbing pain in the left side of the chest. Number 5. Persistent cough. In conclusion, it's important to be aware of the potential signs of heart trouble and seek medical attention promptly if you notice any concerning symptoms.